Good afternoon, everybody. My name is Derek Tarvin, and welcome to Medicare Basics, sponsored by Hoag Hospital, the Hoag Medical Group, and the Hoag Physician Partners. And they have an excellent team of primary care physicians that treat internal medicine, family medicine, and they have over 350 specialists in their medical group. And again, my name is Derek Tarvin, and I've had the honor and privilege of working with Hoag Hospital as an outside insurance consultant for over 25 years. I have an office in Costa Mesa. We have a family business, and we counsel everybody on Medicare, Medicare options, and we help educate everybody on their individual choices. We never charge a fee, and today we'll be going over what is Medicare, signing up for Medicare, the two main choices for Medicare plan coverage, which can be Medicare Advantage HMO or Medicare Advantage PPO. The Medicare supplements, also known as Medigap plans. We'll be talking about the Medicare Part D prescription drug coverage, extra help, and the various enrollment timeframes. So what is Medicare? Medicare, also called Original Medicare, is health insurance for persons that are age 65 or older, or any of those that have had end-stage renal disease or Lou Gehrig's disease. Medicare has four different parts. Medicare Part A is your inpatient hospital coverage. Part B is where all your medical services fall under. Part C is what they designate the Medicare Advantage plans. And Part D is considered the prescription drug coverage. Only Medicare Parts A and Part B will appear on your red, white, and blue Medicare card when you receive it. And on the screen, that's an example of the card you will receive in the future. So Medicare Part A, this is your inpatient services under Original Medicare. Most do not pay a premium for Part A of Medicare. It was paid by you or a spouse through payroll taxes while working. And it helps cover inpatient services in hospitals, skilled level of nursing care in nursing facilities, hospice, and limited medically necessary home health care. Medicare Part B, this is where all your medical services fall under, whether you're an inpatient or outpatient. Most do pay a premium for Part B of Medicare. The standard premium for Part B of Medicare this year is $148.50 per month for Medicare Part B, but it can be more depending on your income. The premium for Part B of Medicare is deducted from your Social Security benefits, or otherwise, if you're not drawing Social Security, they bill you quarterly by mail for your Medicare Part B premiums until if and when you start drawing Social Security. And at that time, they'll withdraw your Medicare premiums automatically monthly. Part B of Medicare helps cover your medically necessary doctor services, outpatient care, tests, durable medical equipment, limited home health care, preventative services, and more. Those that are higher Medicare income beneficiaries, unfortunately, will pay more for your Part B of Medicare. Social Security looks at your income to determine what your Medicare premiums are, and they always look back 2 years as your modified adjusted gross on your tax return. And if you're an individual filer and your tax return is greater than $88,000, or those that file a joint tax return, your modified adjusted gross tax return 2 years ago was higher than $176. Unfortunately, they will charge you more for your Part B of Medicare. The acronym is IRMA. It's an income-related monthly adjustment amount. And the different levels of premium that you can pay are on your screen, and you can print out the packet to study it in the future. And it can go as high as what you see on the bottom of your screen. And obviously, those that go on Medicare and their income has gone dramatically down, and they're basing your Medicare premiums on your income from 2 years ago, and your income has gone dramatically down, you can actually appeal to Social Security, and they may lower your Medicare premiums based on your current financial status. Otherwise, they audit it every year automatically, and your Medicare premiums can go up or down based upon your filings. So signing up for Medicare. Medicare usually starts on the first day of the month that you turn age 65, unless your birthday falls on the 1st, and they actually backdated a month. If you're receiving Social Security or Railroad Retirement benefits, you'll automatically get your Medicare card mailed to you 3 months before you turn age 65 or the 25th month of receiving disability benefits. And if you're in these situations and you don't receive your Medicare card in the mail, you'll want to contact Social Security, and the number is on your screen. And actually, I think they're open from 8 to 5:30 now, Monday through Friday. And they're one of the better government agencies to deal with. They're very knowledgeable, usually very friendly, and very helpful. And if you're receiving Social Security or retirement benefits and you don't get your Medicare card in the mail, give Social Security a call and ask them, where's my card? So if you're not receiving Social Security or retirement benefits to sign up for Medicare, you actually must sign up yourself with Social Security to get your Medicare card. And there's a couple ways you can do that. You can call them and they'll set up a future telephone appointment. In the past, they would set up or could set up an appointment in their office, but I don't think they're open in person yet. The easiest way is actually to go online. The web address is at the bottom of your screen there. It's ssa.gov. And in the middle on the home page to the right, you want to click on Medicare enrollment, and then scroll down on the next page to enroll into Medicare. And it takes about 10 or 15 minutes. It's a pretty straightforward process. If you have any issues with it online, feel free to give Social Security a call. So there is an initial enrollment period for signing up for original Medicare. You may sign up for Medicare 3 months before you turn age 65, during your birthday month, and up to 3 months after your birthday month. If you sign up 3 months before your birthday month, Medicare will start on the first day of your birthday month. If you sign up during your birthday month or within 3 months after your birthday month, Medicare will start 1 to 3 months after signing up. If you happen to miss the initial enrollment period, there is a general enrollment period that occurs every year between January 1st and March 31st. And if you sign up during this time frame, the coverage will start July 1st and you may incur a late enrollment penalty. Those that are covered by employer-sponsored group health plan have different enrollment scenarios. If you're covered by employer-sponsored group health plan coverage and is based on current employment and there are 20 or more employees, you can actually delay signing up for Medicare Parts A and B with no penalty. However, once employment ends or the group insurance ends, whichever happens first, you have 8 months to enroll into Medicare Parts A and Part B with no penalty. And always check with your benefits advisor or human resource to see how Medicare coordinates with your group coverage. And those that delay signing up for Part B and enroll into Part A only, in the future, there would be 2 forms to fill out to enroll into Part B of Medicare when such time is necessary. One form you would fill out, one form you and your employer or previous employer would fill out, and you submit those to Social Security, and they enroll you into Part B of Medicare if you've enrolled into Part A. So let me back up a slide here. So the general rule of thumb is that if you're working covered under group insurance and there's more than 20 employees, you can delay signing up for Medicare Parts A and or Part B with no penalty. If there's less than 20 employees and you're still working covered under group insurance, usually Medicare becomes primary at that point, and you want to enroll into Medicare Parts A and Part B. There's exceptions to every rule, so always check with your benefits advisor, human resource, to see how Medicare coordinates with your current group coverage. So again, the rule of thumb is if there's 20 or more employees covered under group insurance, or the spouse is working and their dependent is also covered under group insurance, you can delay signing up for Medicare Parts A and or Part B with no penalty. If there's less than 20 employees, again, usually Medicare becomes primary, and you'll want to enroll into Medicare Parts A and Part B when you become eligible for Medicare. And as we mentioned, those that have enrolled into Part A of Medicare only and have delayed Part B of Medicare when the time is necessary, there'll be 2 forms to fill out, and we can email you those forms or you get them online through ssa.gov. And if you have Part A of Medicare and need to enroll into Part B in the future, again, there's one form you fill out, one you and your employer fills out. You submit those to Social Security, and then they enroll into Part B of Medicare. Those that have a health savings account contribution and are still working covered under group insurance most likely will not want to enroll into Part A of Medicare and also delay Part B of Medicare. If you're receiving a health savings account contribution by your employer and you're eligible for Part A of Medicare, still working covered under group insurance, most likely you're going to delay Part A of Medicare because it can have an effect on your taxes, I believe, for your health savings account. So if you have a health savings account contribution by your employer, you're eligible for Medicare, still working, covering the group insurance, most likely you want to delay Medicare Parts A and a Part B until such time as necessary, and you will not have a penalty. Those that are covered by COBRA or the veterans insurance through the VA. So if you're covered by COBRA, this is kind of a tricky one. And COBRA can run a term of 18, sometimes of 36 months. And if you're on COBRA and become eligible for Medicare, you'll have 8 months to enroll into Medicare without getting a penalty because it's met one of the two criterias that either group employment has ended or the group insurance has ended. And COBRA is an extension of your group insurance once employment has ended. And if you become eligible for Medicare and you stay on COBRA for the full term, you'll want to enroll into Medicare Parts A and or Part B within 8 months of being eligible for Medicare so you don't get penalized. And if you become eligible for COBRA, it's always a good idea to check with your employer to see how much COBRA premiums would be, because it can be pretty expensive, and compare that to an individual Medicare policy. We can definitely help you with that. So if you become eligible for COBRA and eligible for Medicare, you'll want to enroll into Medicare A and B within 8 months of being eligible for Medicare and not get penalized. Those that are covered by the VA, you actually need to enroll in the Medicare Parts A and a Part B during the Medicare initial enrollment period to avoid any penalty. So if those veterans that are on the VA insurance, you become eligible for Medicare, even if you're not going to enroll in an individual Medicare plan, you'll still want to enroll into Medicare A and B so you don't get penalized. It's kind of stinky, but you'll want to do it. So now we're going to talk about the two main plan choices for Medicare coverage. One option we'll talk about is the Medicare Advantage plans, which can be a Medicare Advantage HMO or Medicare Advantage PPO. With the Medicare Advantage HMOs here in Orange County, most pay a zero premium or a very low premium. And the Medicare Advantage PPOs actually have a pretty sizable premium. And with either the Advantage plans, the HMO or the Medicare Advantage PPO, the drug coverage is usually incorporated into the benefit, so you don't need a separate policy. The other type of individual coverage to go along with your original Medicare we'll be talking about is the Medicare supplements, also known as Medigap plans. With the Medicare supplement plans, you do pay a premium for the Medicare supplement on top of what you pay for your Part B of Medicare. And the drug coverage, the Part D drug coverage, is not included with the Medicare supplements. You actually must sign up for an individual Part D drug plan, which would be a third premium involved. For either the Medicare Advantage plans or the Medicare supplements, you must be enrolled into Medicare Parts A and or Part B. So the first type of individual coverage that we'll talk about today is the Medicare Advantage plans, which can be a Medicare Advantage HMO or Medicare Advantage PPO. They are also known as Medicare Part C. The Medicare Advantage plans combine the Medicare Parts A and a Part B and the Part D drug coverage into one plan. The plans usually include extra coverage like vision, hearing, and dental. Each Medicare Advantage plan has different costs, co-payments, insurance, co-insurance, or yearly out-of-pocket maximums that you pay before they cover 100%. And the drug coverage is usually incorporated into the benefits. Prior authorization is required for certain procedures. And plans, the Medicare Advantage plans, do cover you worldwide for emergency and urgent care in case you're traveling. And the benefits for the Advantage plans can change, and they do each year. So Medicare Advantage plans can be an HMO or Medicare Advantage PPO. So the Medicare Advantage HMOs, you actually must get your care from the plan's network providers and hospitals, except for emergency or urgent care situations. With the Medicare Advantage HMOs, you actually select a hospital, medical group, and a primary care physician from the plan's network providers in your service area. And referrals are required to see specialists. So the Medicare Advantage HMOs, the insurance companies like the umbrellas, they provide the medical benefits. And then there's many, many different medical groups that contract with the Medicare Advantage HMO plans. And depending on what medical group you choose your primary doctor from will dictate what doctors and hospitals you have access to with the Medicare Advantage HMOs. And to make sure you receive all your services through Hoag facilities, and Hoag physicians, with the Medicare Advantage HMOs, you'll want to choose your primary doctor from the Hoag Medical Group or the Hoag Physician Partners directory. And that way, again, it will make sure you receive all your services through Hoag, the Hoag facilities, and the Hoag physicians and specialists. With the Medicare Advantage plans, the HMO plans here in Orange County, most of them have a zero, or there's a few that have a very low premium. You always are enrolled in Part A and Part B and paying your Part B premiums. And then you'll have co-payments or co-insurance for authorized services received from in-network or from out-of-network providers. If you self-refer out of the network or just self-refer period other than emergencies or urgent care situations, unfortunately, you will pay the full cost of non-authorized services, except for emergencies or urgent care situations. So you always want to go through your primary doctor to be referred through a specialist with the Medicare Advantage HMO plans. With the Medicare Advantage HMOs, the Part D drug coverage is included in most of the plans, so you don't need a separate policy. So the Medicare Advantage can be HMO or it can be a Medicare Advantage PPO. With the Medicare Advantage PPO, you use in-network plan providers or out-of-network plan providers that agree to accept the plan. Referrals are not required to see specialists, and you do pay a premium for the PPO plan, and you always are enrolled in Part A of Medicare and paying your Part B premiums of Medicare. And with the Medicare Advantage PPOs, you will have plan deductibles, co-payments, and co-insurance for authorized services received in-network or out-of-network. And if you refer out of the network, you will have higher co-payments, co-insurance, and out-of-pocket maximums that you must pay before they cover 100%. And the Part D drug coverage is included into the plans. The Medicare Advantage plans used to be popular years ago, but they're not very popular these days. They have a pretty sizable premium, and most of them have an out-of-pocket maximum that you have to pay $6,700 out-of-pocket in-network before they cover 100%, and $10,000 out-of-pocket out-of-network before they cover 100%. So if you're thinking about a Medicare Advantage PPO, we would most likely recommend a Medicare supplement plan, which we're going to talk about now. The Medicare supplement plans, also known as Medigap plans, are supplements to original Medicare and pay secondary to original Medicare. With the Medicare supplement plans or Medigap, you can choose any doctor, any specialist, or hospital or facility nationwide that takes Medicare patients. Referrals are not required to see specialists, and prior authorization and reapprovals are generally not required. Actually, there's a little typo on here. Excuse me, it says no prior authorizations and approvals are required with the Medicare supplement plans. The Medicare supplements or Medigap plans, they have 10 standardized plans that you can choose from and are sold by various Medicare-approved insurance companies. With the Medicare supplement plans, there are 10 standardized plans you can choose from. And the different companies will charge different premiums for the same standardized Medicare supplement plans. You do pay a premium for the Medicare supplement plans on top of what you pay for your Part B of Medicare. And the Part D drug coverage is not included with the Medicare supplements. You actually must choose a standalone Part D drug plan, which is the third premium involved. You have your original Medicare Part B, you have the Medicare Supplement Plan premium, and then you have a Part D drug coverage premium. The benefits for the Medicare Supplement plans are what they call guaranteed renewal for life. The benefits for the Medicare supplements can never be changed, and the policy cannot be canceled ever besides non-payment of premium. So the Medicare Supplement plans, there's 10 standardized plans you can choose from. And unfortunately, those that are new to Medicare Part A as of January of last year or past are not eligible for Plan F, which is the highest benefits for the Medicare Supplement plans. But don't be alarmed, because those that don't qualify for Plan F, Plan G is the closest in benefits. They're almost identical. There's just a small deductible that you pay. So those that are new to Medicare A as of January of last year are eligible for Plan G or the G Extra. And if you'd like, we do have a Medicare Supplement comparison chart that we can email you to. We're in the process of updating it for 2021. It has a nice spreadsheet that you can see that shows you what your original Medicare benefits are, the various Medicare Supplement plans on there for comparison. On the back, it has a lot of the enrollment scenarios that we'll be discussing as well future into the presentation. So the Medicare Part D is what they consider the prescription drug coverage with your Medicare plans. The Medicare Part D coverage is available to anyone that has Medicare Parts A and or Part B of Medicare. Medicare itself does not sell the Part D drug plans. To get a Medicare Part D drug coverage, you actually must enroll into a plan. And there's two different ways to get your Medicare Part D drug coverage. You can buy a standalone Part D prescription drug coverage to go along with the Medicare supplement. There's 32 different drug plans you can choose from. And the other way you can get your Part D prescription drug coverage is enroll into a Medicare Advantage HMO or PPO plan that includes the Part D prescription drug coverage in the plan. And the Medicare Part D, they have formularies and drug tiers that they place the prescriptions on. Each Medicare Part D drug plan has a different list of drugs that it covers called a formulary. The plans will place the drugs into different formulary tiers, and they can be from tiers 1 to tier 6. Each tier has different co-payments and co-insurance amounts that you pay. So an example, a tier 1 can be considered a preferred generic, which would be the lowest copay. A tier 2 would be considered a generic drug. Tier 3 is classified as a preferred brand classification. Tier 4 can be a non-preferred drug classification. And then Tier 5 and Tier 6 can be placed on high-cost injectables or specialty drugs. And again, each Part D drug plan has formulary tiers that they'll place the prescriptions on. And each drug plan, they will vary on how they cover your prescription drugs. And how we make a recommendation for the drug plans, either through the individual 32 Part D drug plans that you enroll with the supplements, or those that are incorporated in the Medicare Advantage plan, we can input your prescriptions and we get a line-by-line itemization of all the drug plans and list them from which drug plan is least out of pocket to which is highest annually. So that's how we make recommendations for the drug plans, whether it's a standalone drug plan or those that are incorporated with the Medicare Advantage plans. Those that enroll in a Medicare supplement and are not taking prescription drugs, we just recommend the lowest cost premium plan so you have the drug coverage in case you need it and don't get penalized for enrolling late. So the Part D drug plans, whether they're integrated with a Medicare Advantage plan or a standalone drug plan that you purchased along with the Medicare supplement, all have the same stages. They can have 4 different stages. Stage 1 can be considered a deductible. Not all plans have a deductible, but if they do, the deductible this year can be as high as $445. So if you have a deductible, you'll pay the full cost of your prescriptions until you've paid the full $45 out of pocket. And as I mentioned, some plans have no deductible. Stage 2 is what the Part D drug plans consider the initial coverage stage. And in the initial coverage stage, you'll pay the co-payments or co-insurance for your prescriptions depending on what formulary tiers your drugs fall under, which we talked about in the previous slide, until the full cost or retail cost of your drugs exceed this year $4,130. If you're in the initial coverage stage this year and the full cost of medications exceed $4,130, not what you're paying, but the retail costs exceed $4,130, then you go into the third stage, known as the coverage gap or the donut hole, which you may have heard of. So as we mentioned, if you're in this coverage stage and the full cost or retail cost of the drugs this year exceed $4,130, then you'll enter the coverage gap, also known as the donut hole. And typically this year in the coverage gap or the donut hole, it's called, you'll pay 25% of the cost of generic drugs or 25% of the cost of brand drugs until you've paid $6,550 in what they call true relative out-of-pocket. If you exceed $6,550 in the true relative out-of-pocket this year, which includes any deductibles, co-payments, and co-insurance that you pay, then you will go into the next stage, also known as the catastrophic coverage stage. So this year, if you enter the catastrophic coverage stage, you'll pay $370 for generics, $920 for brand drugs, or 5%, whichever is greater, until the end of the calendar year. And then it resets back to the beginning. And the drug companies will send you monthly statements where you are in the different coverage stages, and the pharmacy will also keep a record of that. As each year, the drug companies will send an annual notice of change in October to inform you of any changes to your particular drug coverage for the upcoming year. So let me back up a couple slides here, because it's kind of confusing. So what gets you out of the initial coverage stage into the coverage gap is the retail cost of the drug. So if you're in the initial coverage stage this year and the retail cost of the drugs exceed $4,130, then you go into the coverage gap. And what gets you out of the coverage gap into the catastrophic coverage stage is any deductibles you pay contribute towards the $6,550 true relative out-of-pocket. Any co-payments or co-insurance that you pay in the initial coverage stage contribute towards that. And when you're in the coverage gap, the 25% of the cost of generic drug contribute towards that $6,550, and the percentage of brand drugs you pay, the 25%, contribute towards the $6,550. And when you're in the coverage gap for most brand drugs, the other 75% you're not paying are paid by the manufacturer towards that $6,550. So fortunately, you don't pay the full $6,550. There's a good chunk paid by the manufacturer in the coverage gap. So once what you pay in the initial coverage stage, the deductible and coverage gap, and what the manufacturer contributes towards brand drugs in the coverage gap exceeds $6,550, then you'll go into the catastrophic coverage stage, and you'll pay much less for your prescriptions until the end of the year. Then unfortunately, you reset back to the beginning. Those that are higher Medicare income beneficiaries that pay more for your Part B of Medicare, unfortunately, will also pay more for your Part D of Medicare. And again, those that are filing individual that have a modified adjusted gross income 2 years ago above $88,000 or $176 for a joint tax return will pay more for your Part B of Medicare as well as your Part D of Medicare. It's called the income-related monthly adjustment amount. And the different income-related monthly adjustment amount that you can pay for your Part D is on your screen, and it can go as high as that. And again, if your income has gone down dramatically when you go on Medicare and they're charging you this IRMA or income-related monthly adjustment amount, you can call Social Security and discuss your current financial status, and they may lower your Medicare premiums for Part B and Part D based on your current financial status. Otherwise, they will audit it each year. Those that do not enroll into a Part D drug coverage and delay it, or have a break in continuous drug coverage for 63 days or more, and you don't have other credible coverage, when you enroll into Part D in the future, a late enrollment penalty will be added to your Part D premium for life. It's not a huge penalty, it's more of a nuisance, but it can accrue. The penalty is 1% of the national base premium multiplied by the number of uncovered months. So I believe the national average base premium this year is $35. And if you go 3 years without coverage, that'd be 36% of $35, I believe is around $8 and something per month. That will be tacked on to any monthly premium that you have for your Part D drug coverage for life. So whether you're taking prescriptions or not, is a good idea to enroll in some type of drug coverage so you have the coverage and don't get penalized later for enrolling late. Extra help. So this is a Medicare program that helps people with limited income resources pay for Medicare drug costs. It's also called limited income subsidy. It can pay for monthly plan premiums, deductibles, co-insurance, and co-payments. If you think you qualify for this, give Social Security a call and discuss your current status with them, and you may get extra help. So now we're going to talk about the various enrollment timeframes for the Medicare plans that go along with your original Medicare. There is initial election period, turning 65 or new to Medicare. There's a special election periods based on different scenarios, such as leaving employer-sponsored group health coverage, permanent move, 12-month trial basis. There is an annual election or enrollment period that occurs every October 15th through December 7th. It is for existing Medicare Advantage plan or Part D drug plans only, or any Part D or Medicare Advantage plan, excuse me. And the bottom one, the Medicare Advantage open enrollment period, is a relatively new one for existing Medicare Advantage plan members only. So the initial election period, turning 65 or new to Medicare, and those that are enrolling into a Medicare supplement and mini gap plan. You have guaranteed issue, no health questions or no pre-existing conditions held against you for 3 months before your Medicare Part B eligibility, up to 6 months after your Medicare Part B effective date to enroll in a Medicare supplement plan. Those that are turning 65 or new to Medicare and are enrolling into a Medicare Advantage HMO or PPO, you may enroll 3 months before to 3 months after your Medicare eligibility or the month you turn 65 with no health questions. Those that are enrolling into a Part D prescription drug plan, you have 3 months before, 3 months after your Medicare Part A and or Part B effective date, whichever was first, with no health questions. So for the Advantage plans, you must have Medicare Part A and be enrolled into Part B. For the individual Part D drug plans, you must be enrolled in the Medicare Part A and or Part B. Those that are leaving employer-sponsored group health plans and want to enroll into a Medicare supplement or Medigap plan, you have guaranteed issue, no health questions, for 63 days after your group insurance ends to enroll into a supplement with no health questions, or 6 months if you're new to Part B to enroll in a Medicare supplement if you're leaving your group health coverage. To enroll into a Medicare supplement plan, you must be enrolled in Medicare Parts A and or Part B. Most people are going to coordinate their individual Medicare insurance to start the day after your group insurance coverage ends. But if you miss that date, you do have this window to enroll into a Medicare supplement with no health questions. So those that are leaving an employer-sponsored group health coverage and want to enroll into a Medicare Advantage HMO or PPO, instead of 63 days, you have 2 months to enroll into a Medicare Advantage plan once the group insurance ends. And to be eligible to enroll into a Medicare Advantage plan, you must have Medicare Parts A and Part B, excuse me. Those that are enrolling into a Part D prescription drug coverage, you have 2 months once your group insurance ends to enroll into a Part D drug coverage, and you must be enrolled into Part A or Part B. So there are special enrollment or election periods. There is a 12-month trial right. Those that are turning 65 and new to Medicare, and you enroll into a Medicare Advantage plan initially, you have a 12-month window to try out the Medicare Advantage plan. If for any reason during the initial 12 months you're not happy with the Advantage plan, they'll give you a special enrollment period to terminate the Advantage plan anytime during the initial year and enroll into a Medicare supplement or Medigap plan and a drug plan with no health questions. Those that have a Medicare supplement plan and want to enroll into a Medicare Advantage plan initially, they will also give you a 12-month trial basis at that time. Unfortunately, they don't give you both 12-month trial bases. They give you one or the other. But those that have a Medicare supplement and enroll into a Medicare Advantage plan for the very first time, they'll give you a 12-month trial basis to try the Advantage plan out. If you're not happy with it, you can terminate the Advantage plan anytime during the initial 12 months and get your Medicare supplement back and a drug plan with no health questions. There is one other popular enrollment for the Medicare supplement plans. If you have a Medicare supplement plan and you want to change it, you can actually do so anytime during the year if you can answer health questions no. But if you have health conditions or later on develop health conditions and company Z is a more attractive premium for the same coverage, every year on your birthday, if you have a Medicare supplement plan in force, you have 60 days after your birthday to enroll into a Medicare supplement plan that has equal or lesser coverage, no health questions. And that's every birthday anniversary that you can make that change with no health questions. So what's up on your screen now, we get real busy in our office during this time frame. It's called the annual election or enrollment period. It's a time frame that you can enroll, disenroll, or switch your Medicare Advantage plan or a Part D prescription drug plans only, not the Medicare supplement plans. It doesn't adhere to this time frame. So all Medicare beneficiaries can join, switch, or drop Medicare Advantage plan or Part D prescription drug plan during this time frame. And for the Advantage plans, you must have Part A and be enrolled in Part B. And for the Part D drug plans, you must be enrolled into Part A and or Part B. If you make a change during this time frame, the new plan becomes effective January 1. So this one's pretty new. It's a Medicare Advantage open enrollment period. And this is for existing Medicare Advantage plan members only. If you have a Medicare Advantage plan, you can switch to a different Advantage plan during this time frame once, or you can disenroll from Medicare Advantage plan, go back on original Medicare, and apply for a Medicare supplement plan and enroll in a Part D drug plan. If you're going to use situation 2, coming off a Medicare Advantage plan and want to enroll in a Medicare supplement plan, we highly recommend enrolling into the supplement or applying for the supplement. Make sure you get it issued before enrolling into a drug plan, because if you enroll into a drug plan, it'll automatically cancel out your Medicare Advantage plan, and you may not get approved for the supplement. So we don't ever want to leave anybody without health insurance. So if you're going to want to disenroll from the Advantage plan and apply for a supplement, we highly recommend applying for the supplement. Make sure you get issued before enrolling into a Part D drug plan. I know we went over a lot of information. I will take some questions now. And if you have any more questions, want any more information, or like to set an appointment, my information is on the screen. We counsel everybody at my office. We don't ever charge a fee, and we'll be glad to hear from you. So I do have a few questions now. So let's take a look here. So it says, what if you don't want to receive Social Security benefits, but you want to enroll into Medicare? This person would like to defer their Social Security benefit when they turn 65. So that's a very good question. We get this one often. Social Security income and Medicare are two different options that you have, and they're not dependent on each other. So if you're turning 65 or coming off group insurance and you want to delay your Social Security, you can delay it to whichever time you like and just enroll into original Medicare A and B. And again, if you want to enroll in original Medicare, you can call Social Security. They'll set up a future telephone appointment, or you can go online to ssa.gov and then enroll that way. It's a pretty straightforward process. So if you're eligible for Medicare and want to delay Social Security, that's not a problem. You can delay your Social Security until you want to start drawing it and just enroll into Medicare. Let's see here. So if I do have a Medicare Advantage, HMO, and I regularly see a specialist, do I need to have a referral for every quarterly appointment? That's another good question. So with the Medicare Advantage HMOs, if you see a specialist regularly, 3, 4, 5, 6 times a year, you don't need to keep going back to your primary care physician. Once you get a referral to the specialist, you have what's called a standing referral. and the specialist office will actually contact you when your next appointment is coming up. If it's a new condition, then yeah, you do need to go to your primary care physician initially to get a referral to a specialist, but you do not need to keep going back to your primary care physician if you have a standing referral throughout the year for that particular specialist. Let's see here. So the next question is, why could one not have Part B initially? So I'm not exactly sure on the full question here, but if I don't answer it correctly, please contact Ho, give him email or call, let me out my office, and we can expand on this further. So those that are eligible for Medicare and they have group employment coverage and there's more than 20 employees and they become eligible for Medicare, most just sign up for Part A of Medicare and delay Part B of Medicare because it doesn't coordinate with your group insurance if there's more than 20 employees. And most people don't pay for Part A of Medicare, but Part B, if you're covering group insurance and there's more than 20 employees, you'll be paying a premium for Part B of Medicare for no reason because, again, it's not going to coordinate with your group insurance. So if you're eligible for Medicare and you're covered in a group insurance, there's more than 20 employees, I would delay Part B of Medicare. That's really one of the only reasons if someone's eligible for Medicare that they would delay Part B of Medicare. Otherwise, if you become eligible for Medicare and you have no other group insurance, no other insurance, you'll definitely want to enroll into Part A and or Part B and get some type of individual coverage to go along with your Medicare A and or Part B. I'm not sure if I answered that correctly, but if we haven't, please contact me. It'll be good into that question further. And the last question is, which plans can you change? So I'm assuming this is referring to the Medicare supplements and or the Medicare Advantage plans and the Part D drug coverage. We kind of touch bases on when you can change them. Those that have a Medicare supplement plan, every couple of years is a good idea to review those to see how the premiums are compared to other companies. A change may be warranted based on that. The Advantage plans, the benefits can change every year, and the Advantage plans that have the drug coverage, the prescription drug coverage can change every year. So it's always a good idea to review those plans each year to see how they cover your prescriptions and if the medical benefits have changed. So that may be another reason to change. And the Part D drug coverage, I can't emphasize this enough. Whether it's a standalone Part D drug plan that goes along with the supplement or those that are with the Medicare Advantage plans, the benefits for the Part D drug coverage change every single year, and your prescription drugs may change. And whether your prescription drugs change or not, it's highly recommended to review those plans every single year during the annual election period, which is every October 15th through December 7th, because the drug plans benefits can change every year. What drug plans are offered can change every year, and your prescriptions may change. And we get extremely busy, and we'd be glad to help you review your drug coverage each year during that time frame because they do change dramatically every year. So it's not a good idea to get comfortable with your Part D drug coverage ever because they are on a constant state of flux, unfortunately. And I'm not sure if I have any other questions. Do you have any other questions?
There's one more.
Oh yeah, we got one more.
So I'm just gonna read it off.
Okay.
I have employer-based PPO. What plan is the easiest transition to Medicare when I retire?
So the person has a a PPO coverage through their current employer coverage, and they're asking what I'm assuming would be the most like their PPO type of coverage through their employer, which would kind of steer you towards a Medicare supplement plan. With the Medicare supplement plans or Medigap, you can self-refer to any doctor, any facility throughout the United States, take Medicare patients, and your coverage is the same through any state. You don't have to have referrals to see specialists or authorization for procedures. And they're really like super PPOs. A lot of people interchange PPOs and supplements. With the traditional PPO, you have certain deductibles, co-payments, co-insurance, and out-of-pocket maximum that you pay a year before they cover you 100%. Then if you self-refer out of the network, you usually have higher deductibles, higher co-payments, higher out-of-pocket maximums before they cover you 100%. With the supplements, there's no in or out of network. It's just that you take Medicare or not. And for the most part, with Plan F, you have full coverage, or with Plan G, you have a small deductible, $203, that you pay. And other than that, the deductibles and co-payments that you pay the PPO are paid by your supplement. So with the Medicare supplements, Plan F has full coverage, and Plan G is the closest in coverage, which has this year a $203 deductible that you pay before they cover 100%. So they have excellent benefits and very little out of pocket as far as co-payments, et cetera, with the Medicare supplements. The Advantage plans, they work just as well. They don't have a Medicare, most of them don't have a premium for the HMO plans. And most of the services here in Orange County for the Medicare Advantage plans have a zero co-payment, and they have excellent coverage. They're a little more restrictive on how you can access the providers. Well, we sure appreciate you attending today. If you have any further questions, would like us to email you the Medicare supplement comparison chart, please feel free to contact Hoag Hospital or my office in Costa Mesa. Again, we have a family business, and we don't ever charge a fee for consultation or help under enroll insurance. And we sure appreciate you tuning in today. And we look forward to hearing from you in the future. Thanks a lot. Bye-bye.